Yes, very good afternoon. Thank you. Yes, that's awesome. So today we would like to start. So previous to previous week, right? So we were completed the dermatome, myotomes, sclerotome, enterotomes, syndromes. But of course, this is a very big theoretical aspect. But at the same time, we would like to see here as a revision of the dermatome and myotome and short and sweet, because so we always keep learning. At the same time, we forget very soon as well. Because there is no touch on that, definitely we will forget. So here I would like to emphasize once again to all of you to remember here that so cervical, lumbar, sacrum and then coccyx region, how is communicating to our muscular system. Today, before going to complete the task, definitely I would like to present you. There are certain motor points which is useful for all the musculo-tendinosus system disorders or the skeletal-muscular system disorders. Here is, I would like to start from the beginning as a cervical region, later how that cervical nerves are communicating to the muscular system, and in the so on to the all the till the coccyx, and definitely those certain major muscular system, how those nervous systems are communicating, and in that case how we can able to handle and treat the patient by using the, here is normally all of you know some of the acupuncture points for the previous students, but at the same time here acupuncture points based on the traditional Chinese medicine, and then how that points are communicating to treat for the muscular system in the form of the motor system, in the form of motor connectivity. Because of the motor points are something different from the sensitive points. When we look at about the major 361 acupuncture points are not all the motor points connectivity, whereas in among them very few points are motor system points. So before going to or stepping into that, but I would like to give you as a revision to dermatome, myotomes. So what are the difference between the dermatome and myotome, sclerotome, enterotome and syndromes? So normally short and sweet, keep it in your mind, stating that dermatome here is the Greek word. Derma means we all know it is the skin, and tomes means is the parts or the divisions or the section, right? So that's called as it tomes, or the divided into the some parts of the skin or some parts of the body is called as it tomes. Now dermatomes is nothing but is the skin connecting. Somewhere there is a single nerve is communicating to the skin, or single nerve is communicating to the certain parts of the skin or the group of the skin. So, or the area of the skin is called as a dermatome, right? So these dermatomes are communicating through the spinal nerves. How many spinal nerves are existing? 31 pairs of the totally 62 different spinal nerves communicating across the body bilaterally. So in this case, totally the cervical vertebrae having the how many nerves? How many vertebrae are existing? 7 vertebrae. But how many cervical nerves? 8 cervical nerves are existing, because one nerve is existing above the C1. Right? So therefore that calculated collectively C8 nerves. So C8 nerves are there. Those nerves are communicating to the upper extremities. Upper extremities, that is right side and left side of the till the terminal of the fingers. So in this case, now you understand the C1 is very much essential for the neck flexion and extension, right? The neck flexion and extension is required. So what nerve is very crucial here is C1 nerve. The C2 nerve is bent for the neck, right side and left side bending or touching to the shoulder. In that level, if you wanted to take up, or the C3 for ear touching to the shoulder and the side flexions. When the patient is complaining, there is a pain on my cervical region, that's called as the cervical spondylosis pain is there. The people today, when we look at about the corporate level, or the people who are working on the system are using the gadgets or laptops or the phones or microphones, so definitely they do have the wrong postures. Now, for example, I am talking to you, my eyes are matching to you. When I am continuously seeing the laptop, my neck is bending forward direction, so that indicating there is some kind of pressure on the spinal nerves, the spinal vertebrae. So which causing around 30 to 40, 50 kgs weight you are putting. So that kind of the sensation feels that vertebrae. It's not that, sir, I'm not feeling anything, but you are not feeling. But your spinal nerves or the cervical nerves feeling that kind of the sensation, that so much pressure on the cervical vertebrae. Due to that reason, down the line or over the period of time, definitely they do have the form of the cervical spondylosis. So spondylosis, spondylolisthesis are something, it is connected to the lesion on the vertebra, so many conditions. But here is normally there is a flexion or extension and bending forward and outward. So all are connected to the somewhere there is C1 to C3 nerves are getting impingement or getting the compression which leads to that problem. So in this case, now anything connected to the C1, C2, C3 which covers the entire part of the head also. Remember, this is very important key that. So when all the sense organs also connected to the C1, C2, C3 and the neck portion, the cervical vertebrae which we call as the pons, medulla oblongata which we call as a brain stem, all are connecting to the cervical vertebrae as well. Right? So in this case, anything connected to this problem definitely cause to the vision related disturbances or the ear related disturbances or the nose related, mouth related condition, throat related issues. So all our head is connected. Above your neck region is head. So what are the sense organs or what are the organs are connected to that are located vicinity of that area. So that to be calculated by using the cervical nervous system. C1, C2, C3 is the very much crucial. When we are treating some organ to the nose related problem or the mouth related issues or the frontal head related problem, definitely we can add up the C1, C2, C3 nerves also included here. At the same time, is the patient is suffering that the neck flexion and extension to be not taken place precisely or the side flexion is not happening. So in this condition, definitely there is a certain muscles also affected, certain nervous system also affected. Now, based on today's topic, now you're going to understand that there is a problem on the cervical region, then definitely we need to understand to treat for the muscular system and nervous system collectively. Right. So now what to be taken place? So here you just maintain to apply the needle on the C1, C2, C3 region, half tuned lateral to the cervical vertebrae, but make sure that on the center you should not touch to that region. For example, the posterior midline of the head is there. So that head points are called as a Yemen and Feng Fu. That is the DU15 and DU16. Those points are very, very good point to treat for the occipitalis muscles or the posterior side of the head pain or sometimes connected to the, related to the neck related issues as well. Neck pain also can be treatable. But make sure that should be applied the needles precisely 0.5 tune maximum is recommended. So 1 tune needle should not insert on that particular region. That definitely leads to the medulla oblongata or the pons will going to damage over that region. It's a good use only the half tune is recommended, whereas if you are using the cervical spondylosis which is connected to the vision related problem, remember always occipital region where we call as the visual cortex of the brain also existing. Due to that reason the occipital protuberance proximal to that, so that region is called as the visual cortex region of the brain. So which is communicating and controlling and regulating to the vision as well. So therefore when you are treating below that, so definitely the occipitalis muscles you are treating to regulate not only that vision, at the same time that tension of the neck muscles can be regulated by activating this particular region. So therefore you just add up whenever you wanted to treat. No doubt there are the certain acupuncture points are located on that region. Those points called as the Tianzu, the point is UB10 point, and then Fench, that is the gallbladder 20 point is located. So and then gallbladder 12, head Wangu, the points are 3 points are in one line and bilaterally there are the 6 points are located. When you wanted to use the extraordinary points over the region, of course the points called as the Anmian 1, Anmian 2. Those points also located midway between the gallbladder 20 and then Efen, that is the Sanjo 17 region. So those entire on the occipital region, you can find the points to treat for the cervical spondylosis. At the same time, the occipital headache, which directly, indirectly communicating to the vision as well. Right? When the people who are suffering for the Bell's palsy or the facial paralysis, or the students, children in these days suffering for the myopia or the hypermetropia or astigmatism, or the aged persons are suffering this kind of the vision problem, definitely for them also we can able to treat by using this connectivity point. Since you are treating to the ophthalmic nerve, you are treating to the optic nerve, you are treating to the retina nerve also. Because of the retina is communicating to the deepest part of the eye system, which indirectly communicating to the visual cortex of the brain. Right? So in this case, now you are communicating here not only to the eye, but indirectly you are communicating to the visual cortex of the brain to reach the retina, macula connectivity to the eye system to regulate the optic nerve also. So at the same time, no doubt there is a 3 nerves are there, V1, V2, V3 nerves. So V1 denotes here is the ophthalmic nerve, and V2 denotes for the maxillary nerve, and the V3 denotes here is the mandibular nerve. So 3 nerves also communicating through this cranial nerves are supporting. But of course there are the other points also, facial nerve. There are the local points are existing for the ophthalmic region, where we call as the Ta-Yang point is located midway between the Sanjo 23, Sisukum, and then Tum-Silio, gallbladder 1. The point is located on the temporalis muscles. So this point is also directly helping to the ophthalmic nerve. Right. At the same time, of course, you are using as a local point to treat for the vision, then definitely you can add up the point called as a Sansu. That point is UB2. Right. UB2 is located on the medial end of the eyebrow. Definitely that needs to be bleeded. Make sure. When the excessive chi is accumulated, the fire is more retention on the vision region. That time we need to bleed or we need to extract the amount of the blood, because when we look at about the vision, there is the darkness is there or the redness in the vision, eyes. So that indicating the more excessive fire is accumulated on the eye system, need to be bleeded. It's not that you need to apply the needle inside the eye system, need to be bleeded. Of course, there are the external manifestation. There are the certain points are located. Those points called as a Sansu point is there. You need to bleed that. At the same time, you need to activate. There are the other points to be bleeded. Those points called as a Sisukum and Tum-Silio. That is the gallbladder 1 and Sanjo 23. Through needling can be taken place. Otherwise, you can apply the bleeding on those particular spots also. Good to treat for the, if there is excessive accumulation of the energies inside the vision, we can bleed it. At the same time, when we wanted to treat for the posterior region side, gallbladder 20 you are activating, then immediately you just withdraw the needle very strongly. Insert the needle very slowly. But how to apply that needle? You remember, this is very important key. So just you apply the needle, one needle on the GP20 on the opposite direction of the eye system. When you are treating to the right eye, apply on the left direction, vice versa. Right? I'll show you that practical how to be activated by using the gallbladder 20 in the slow insertion, and then very rapid withdrawal of the needle should be taken place. Right? If there is excessive fire is there inside the eye system, if there is energy is required to the eye, then you understand, slowly insert the needle and then withdraw the needle also slowly. You just close the hole. In that way we can manipulate. These are the points. But make sure now you understand, this is your half tone above the DU15 and DU16 is not recommended, but whereas if you are using on the C1, C2, C3, it is recommended to use the needling depth is 1 tune to 1.5 tune, also recommended to use the needling depth. But however, as a beginner, I don't recommend here to apply the 1.5 tune, definitely it is not recommended, but here is advisable, use half tune. But here the authors writes that, so 0.5 tune to 1.5 tune also recommended to apply the needle on this specific region. But however, here is, you wanted to activate is the subcutaneous level or the cutaneous level, definitely you can use 0.5 tune to 1 tune maximum. You can apply this C1, C2, C3 region. Definitely that have the great impact not only for the sense organ. Of course, the ear tinnitus is there, or the ear problem is there, or the otitis media is there, otalgia is there, something connected to the deafness is there, deaf mutism is there, the aphasia is there, the people who could not able to talk very clearly, even that condition also we can activate this, by activating these points, so that indirectly will be helpful to the tongue also. Right. So if you wanted to use that particular condition, there are the many motor points also existing that we can activate certain points. You just apply the center of the tongue 1 point. So we need to give the strong stimulation to that point. Right. In this way also we can activate by using the certain motor points as well. Now you understand about there is a head related problem. Please repeat with me. If there is anything, the head related problem, frontal headache, temporal headache, occipital headache, parietal headache, or anything, the sense organs are connected, the ear, nose, throat, mouth and lips, tongue, right? At the same time, cervical spondylosis is there. So of course the above C1, C2, C3, but cervical spondylosis again it causes from the C4, C5, C6, C7, C8. That also will come to that. But now head related problem can be treatable. But how many nerves are involved here? Yeah, repeat that one. C1, C2 and C3. C1, repeat with me. The head related problem can be treatable by activating how many spinal nerves? 3. C1, C2, C3. Head problems treatable by C1, C2, C3. Repeat with me. As a primary school children. There is no energy. Yeah, I am fasting. But you people are, I think, had your lunch. Come on once again. The head related problem, sense organ can be treatable by activating the spinal nerves of loud speaker. Yes, good. So you never forget, no? Right? Good, awesome.